Understanding Dysosmias, When the Sense of Smell Goes Awry by AZLAN ADNAN MA, Saturday, 1st of November 2025. Introduction. Dysosmia is a general term for disorders that alter the way smells are perceived. Some people experience heightened sensitivity, while others lose their sense of smell entirely. For many, once pleasant odors become distorted or repulsive. Though often overlooked, the sense of smell shapes appetite, safety, memory, and emotion. When it falters, daily life becomes strangely muted, food tastes bland, flowers lose meaning, and the world feels unfamiliar. The science of smell. Olfaction begins when airborne molecules enter the nasal cavity and bind to receptor cells inside the olfactory epithelium. These cells send electrical signals to the olfactory bulb, which then relays information to the brain's limbic and cortical areas. If any part of this pathway is damaged through infection, injury, or neurological decline, the result is dysosmia. The condition can affect one or both nostrils, appear suddenly, or progress gradually over time. Types of dysosmias. Hyperosmia is an unusually heightened sensitivity to odors. Everyday smells may seem intense or intolerable. It can occur during pregnancy, migraines, or certain hormonal or neurological changes. Hyposmia refers to a reduced ability to detect odors. Mild loss of smell is common with aging or nasal inflammation. Parosmia involves distorted smell perception. Coffee may smell burnt, fruit may seem rotten. It often arises after respiratory infections or nerve injury. Phantosmia occurs when a person perceives smells that are not actually present, often smoky, chemical, or foul. These phantom odors can be distressing and sometimes point to sinus disease or neurological conditions. Anosmia is the total loss of smell. It may be temporary, caused by congestion, or permanent if olfactory neurons are destroyed. Together, these categories describe the wide spectrum of olfactory dysfunction known as dysosmias. Causes and risk factors. The causes are diverse. Viral infections, such as COVID-19 and influenza, are leading culprits. Chronic sinusitis, nasal polyps, or allergies may block odor molecules from reaching receptors. Head trauma can sever the fine nerve fibers that connect the nose to the brain. Neurological disorders such as Parkinson's, Alzheimer's, and epilepsy can also damage olfactory pathways. Aging, hormonal fluctuations, exposure to toxins, or the side effects of medications can further impair smell perception. Diagnosis and testing. Clinicians diagnose dysosmia through smell identification and threshold tests. Patients are asked to identify familiar scents or rate their intensity. Nasal endoscopy may reveal physical obstructions or inflammation. Imaging, CT or MRI scans, helps detect tumors, injuries, or degenerative brain changes. In research settings, scientists are developing biomarkers and digital smell sensors that may one day allow earlier detection of olfactory disorders. Treatment and management. Treatment depends on the underlying cause. If infection or inflammation is involved, steroids, antibiotics, or surgery may help. For neurological or idiopathic cases, olfactory training, sniffing a set of known scents daily, can stimulate regeneration of smell pathways. Managing dysosmia also means adjusting daily habits, avoiding strong chemicals or fragrances, improving air quality, and focusing on food texture and temperature can make meals more enjoyable. Recovery times vary widely. Some regain full function within months, others adapt to a new normal. Living with dysosmia. Losing or distorting one's sense of smell affects more than taste. It alters memory, intimacy, and mood. Many experience anxiety or depression when familiar scents no longer match their memories. Practical coping strategies include labeling perishable foods, using gas detectors, and seeking support groups for sensory loss. Mindfulness and sensory retraining can help restore confidence and connection to one's environment. Conclusion. Dysosmias remind us that smell is more than decoration. It anchors us in the physical world. When that sense falters, it reveals how deeply intertwined scent is with safety, pleasure, and emotion. Ongoing research into olfactory regeneration and neural repair continues to bring hope. Understanding and addressing these disorders is not only a matter of science, but of restoring the full human experience of being alive.